This is very serious. I mean, as you think about it, does Careteam have government support? Is it locally funded? How do you all have enough money to provide the counseling as well as all the testing that's involved, and how simple is the testing? But real quick, I don't want to get to those. If a viewer needs to get off to work now or get family off to school, is there a good phone number, and do you all have a website?
Absolutely. Our phone number is 236-9000.
Okay.
You can call to get information anytime. You can call to schedule an HIV test. We'd be happy to do that.
Okay.
Our website is careteamsc.org.
Okay.
It also has a lot of information about what we do and how to get in touch with us for specific things.
Okay.
So,
and for our viewers in the PD, you've got a sister or brother organization in the Florence area that if they called you, obviously you could help get them in touch with.
Absolutely. There are 11 other organizations like Careteam in South Carolina.
That's
and
great.
We also cover several states.
843-236-9000 or careteamsc.org. Okay,
Yes.
well, let's get back to how easy is getting checked out.
You know, that's the great part. They have a test out now that is non-invasive. It's an oral swab. You don't have to do a blood test. And the test is very accurate. We've never had a false positive so far. You can get the result in 20 minutes. So the length of time that you and I sit here and have a conversation about HIV, you would have a result of your test.
So almost always folks will wait there at your offices, but it's very confidential. I mean, they could be sitting in the lobby and no one knows that they're sitting there waiting for their test results.
Absolutely.
Right. Very confidential.
What we've done in the last few years is take our name off the door.
Right.
And get it out in the community. You know, people don't need to know where we are unless they need us.
Good.
Everybody needs to know that we are and that we're here to help.
Good for you,
so
Johanna. That's smart.
I think that that's important.
Right.
Confidentiality we know is important to everyone, and we want to provide that. So, you know, you don't want to go to your doctor's office and be tested. You don't want to go to the health department and be tested.
Right.
You can come to us, and we'll take care of that. We also have a satellite office in Georgetown, so you would have to come to Myrtle Beach to get a test if you want to do that.
Again, very confidential. What about money? How are you all funded? And are you ever looking for donations? And what's the best way for folks to make them if you are?
Right. Primarily, we're funded through federal grants.
Okay.
And I have folks ask me all the time, why does the federal government give so much money to HIV? And there are so many other diseases that, you know, don't get as much. The issue is that this is an infectious disease and it spreads. Yeah. Okay, and so we make sure that people get treatment, they don't end up really sick and in the hospitals, and that they're living productive lives and out in the workforce, not on disability and, you know, stuck at home dying from a disease. We want folks living good quality lives, and so that's what we're doing. That's what the federal government is helping us do, to decrease the risk of infection with other folks and to help people live productive lives. So most of our funding comes from the federal government, but you know, like everyone else, it's not ever enough. And those funds are very restricted too. There are things that Careteam does that are real important that the federal dollars don't provide. Things like transportation, especially you're talking about county.
In our giant rural areas, someone in King Street who needs to get over.
We can get people into medical appointments, but we can't get people into, you know, support group appointments or mental health or substance abuse counseling appointments, or, you know, the federal money is very restricted about how we can use it. So, you know, it's important that we have funds that help us move in that direction. Our federal dollars also don't support faith-based programs. So for us to get in and help churches out, those funds come from some private foundations, private donations, and they're really very important. And have been very helpful. What we've tried over the last year is to meet with groups of ministers in different communities for them to sit down together and talk about, you know, one, what the issue is, and it's in our community, and how do we bring this into church without, you know, getting people all stirred up and, oh, we don't want to hear about that. Again, folks don't want to hear about that because it's a gay problem.
Yeah, and I'm sure
if it's not, so we get the church leaders to understand the problem in their community, then helping them do the education. We don't have to do that.
Yeah, this is really everyone's problem, because I'm sure you probably find a lot of businesses that may not support because it looks like they're just catering to the gay community or something crazy like that, that they're really not going to be active helping Careteam out because it may be perceived the wrong way, even though you've made very clear this is not a gay man's disease necessarily. Obviously, there are gay men that are impacted by HIV.
Right.
Clearly. There was some other critical point that you made, and just trying to think that through. I'm sorry I got distracted for a second.
Right.
I was just thinking about those businesses, but the basics of if I was HIV, if I wasn't taking any medication to slow it down, how soon would I lose my life in most probability? I mean, how quick is it deteriorated versus a Magic Johnson or versus someone who is actively, or any numbers of your patients,
right.
clients?
Well, HIV is the virus that causes AIDS. Okay, HIV is the virus that attacks your immune system. You don't die of HIV. You die of other things that your body couldn't fight. Okay. Because HIV has destroyed your immune system. Right. AIDS really is an old diagnosis. It was used and identified by the CDC back in the early, mid to late 80s. Excuse me. Because if you came in and your immune system was down a certain level and the amount of virus in your system was up really high, you really didn't have a lot of time to live, 6 months to 18 months. Right. Now that diagnosis is not quite as relevant for us because you can come in pretty bad shape, get on medications, take them correctly, you know, stay in ongoing medical care, and do really well. So that's the good news, and we want to make sure that that happens. Okay. You could actually be infected and be HIV positive for years, though, before physically you start feeling the effects of HIV in your system. And the most noticeable physical or external effects you're going to see are there, is it Philadelphia, something you would perceive the Tom Hanks character, I guess, with lesions or other, or maybe that was all blown out. Not as common anymore. Of course, they still exist, but they're not as common anymore. Most often, and this is scary too. Most often, people don't find out that they're positive until they end up in the hospital really sick, and they have an illness that is most identified with HIV infection. You know, certain strain of pneumonia, that kind of thing. But we want to try to catch people long before they get to the hospital to keep them, the virus, from destroying their immune system. You know, you in medical care and take medications like you're supposed to, you know, you probably have a better chance being hit by a bus and crossing the street than dying from HIV, taking care of yourself. And that's the message that we want to get to people. Know your status. Your status is power. That knowledge is power. Because get in treatment, take care of yourself, and you're going to live a long life. We've just got 3 minutes, Johanna, and if you were, surely I'm sure you do elevator speeches, but I mean, just getting the point across, I think you've laid out a lot of critical ones. Knowing yourself, just having to know, I mean, having to find that out, but ultimately, you've got some people who found out. I mean, what are some of the examples, just so that folks know, I've got to get in there and get that testing done. I want it to be confidential. I need to get checked out, but ultimately they could live, as you say, a long, long life. I mean, if it was just determined in the mid-'80s, you don't have examples of folks living more than 20 years, for instance, after they've contracted HIV. But is the expectation that, and what is the medication itself? What are the most popular forms of medication that are going to help save putting off the deadline? Well, medications have changed a lot and they've improved greatly. Early on in the stage of the disease, you could take 30, 50 pills a day for HIV, and they've gotten single doses and 2 doses a day now. So the medications are much easier to take. They still have pretty bad side effects, at least initially. So we want to make sure we help get people through that part. But staying in medical care is really important. If I was in and out of medical care, didn't take medications the way I was supposed to, what's going to happen is my body's going to be resistant to those medications. So what that means is that if I'm infecting someone else with HIV and I'm resistant to these 10 medications, the person I infect is also resistant to those medications. So we make sure that folks really take medications the way they're supposed to. And for folks who are HIV positive, if they are maintaining their, I don't want to say promiscuous, but their unprotected sex life,
is it most probable that they are going to pass on the HIV, or is it just something that's rarely passed on? I mean, is that...
You know what? People with HIV and who know they are HIV,
right,
they're not the people that are out spreading the
disease.
I
understand. Sure, I'm thinking
it's
more about,
folks
as you say, the know yourself who don't know. Yeah.
Don't know
sure,
their
sure.
status.
So is it
they're
probable
the ones that are out
they are?
there.
You're right. So it's,
yeah.
I guess it's then difficult to gauge whether or not it's passing very easily. I mean, is it an easily communicable through unprotected sex?
It is. Without getting a lot of detail,
right, yeah.
certain sex practices have more risk than others, but all of them have risk.
Right, right.
So it's easier for a man to pass it to a woman, and that's why it's so high in the African American female population right now. So.
Careteamsc.org has some good info about it.
Yes.
Picking up the phone, 236-9000. Whoever's answering there is pretty skilled, and if someone called now and left a message and you all called back, they could answer some basic questions.
Absolutely, and we will ensure confidentiality. That's our business.
Those are great words. Johanna, thanks so much for being with us this morning.
Thanks for having me.
Absolutely. Stay tuned to more Carolina Fever. Johanna Haynes of Careteam coming up next. You didn't hear us talking about pets this morning, did you? I didn't either. We weren't really getting into that, but I love that great acronym. It is a great one. I'm sure Johanna knows what I'm talking about. She may not have thought we'd get into it this morning. Prevention, education, treatment, and support. Think about that, PETS, prevention, education, treatment, and support. But you got to know yourself. Didn't you love that bullet point? Know yourself. 843-236-9000 or careteamsc.org. Take the time to go online. They've got tremendous frequently asked questions, a lot of great info. Johanna shared off camera. If you want to make a donation, you want to target it to a particular thing, like reaching out into the African American community or making an impact on young adults or on teenagers or otherwise, you can be a part of this. 843-236-9000. But what a great, simple mission to empower our community, Horry, Georgetown, and Williamsburg counties, with the means to stop the spread of HIV through prevention, education, treatment, and support. A couple other great things. This is an infectious disease, and it spreads. It spreads, but Careteam wants to make a difference and make a difference in your life. Know yourself. Give them a call, 236-9000. Johanna, thanks so much.
Thanks for having me.
For being with us this morning. Absolutely. Yeah.